Ladies and gentlemen, good morning. Assalamualaikum warahmatullahi wabarakatuh. A very warm greetings to each and every one of you. Welcome to International Visiting Professor, Enhancing Nursing Scholars' Intentions, Motivations, and Skills for the Quality of Research.
Recording in progress.
International Publications, organized by Nursing Study Program, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. I am Dewi Setiawati for the MC for this event. On behalf of the organizing committee, we extend our appreciation for your presence today. The Honorable, the Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. The Honorable, the Head of Nursing Study Program, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. The Honorable Distinguished Speaker, Professor Xu Fang Vivin Wu from National Taipei University of Nursing and Health Sciences, Taiwan. And the Honorable Nursing Lecturers, Nursing Students, and all of the participants this event. The visiting professors will have the opportunity to share their high level of knowledge and experience by giving lectures and holding academic seminars to the academic nursing scholars and students in the Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, purposely about nursing research and international publication in high reputable journals. The event will be held for 2 days on June 13 and 14, 2022. We have two speakers from National Taipei University of Nursing and Health Science and Lincoln University College, Malaysia. Cultivate interdisciplinary talents for precision care and instrument development. The Honorable distinguished guests, ladies and gentlemen, let us all rise for the listening of the Indonesian National Anthem, Indonesia Raya, and Mars Muhammadiyah. Ladies and gentlemen, let us listen to the recitation of the prayer. Will be delivered by Nurse Muhnur Harisna Al-Jihad, Magister Keperawatan Spesialis Komunitas. Would you please?
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa 'azimi sultanik. Ya Allah, ya Tuhan kami, segala puji atas karunia dan kenikmatan yang Engkau berikan kepada kami. Hari ini kami berkumpul dalam kegiatan International Visiting Professor yang diadakan oleh Program Studi Keperawatan Universitas Muhammadiyah Semarang. Ya Allah, berikanlah kelancaran, keberkahan, serta penuhilah pertemuan ini dengan kebaikan dari awal hingga akhir nanti, ya Allah. Ya Allah yang Maha Kaya, bimbinglah kami dengan hidayah-Mu. Jadikanlah ilmu yang kami dapatkan menjadi ilmu yang bermanfaat sehingga dapat menjauhkan kami dari siksa api neraka. Ya Allah, ya Rahman, tunjukkanlah kepada kami bahwa yang benar adalah benar dan berikan kami kekuatan dan kemampuan untuk menjalankannya. Serta tunjukkanlah bahwa yang salah adalah salah dan berikan kami kekuatan dan kemampuan untuk meninggalkannya. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Welcoming speech by Vice Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, Dr. Muhammad Fatkul Mubin, Magister Keperawatan Spesialis Keperawatan Jiwa. Please welcome.
Baik, terima kasih Bu Dewi. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
First of all, let us thank Allah, the Almighty, who has given His grace and guidance so that the 2022 Unimus International Visiting Professor Series can be held successfully. It is a glorious moment to extend my warm wishes on behalf of the Faculty of Nursing and Health Science, University Muhammadiyah Semarang. I want to convey my heartfelt gratitude to Prof. Sufang Vivinevu, President of National Taipei University of Nursing and Health Science, who already gave her time to be here as our distinguished speakers of today's lecture. I believe that this 2022 Unimus International Visiting Professor Series will be the source of the innovative ideas, concepts, and breakthroughs, not only the collaboration of university, but also in improving the knowledge and of the student in terms of nursing globally. Distinguished delegates and participants, please allow me to introduce the Faculty of Nursing and Health Science, Universitas Muhammadiyah Semarang. Our faculty is one of 8 faculties in university. The content consists of 11 study programs. Our faculty has the greatest number of students in the university. The program are nursing, midwifery, food technology, nutrition, medical laboratory technologies, consists of diploma, bachelor, and profession degree. Welcome all of the student and faculty member to this agenda that will be held in several meets with different professors from several universities. Therefore, I want to express my gratitude especially for the organizing committee for their hard work, perseverance, and patience in preparing this lecture so it can be held successfully today and the few months ahead. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Okay, ladies and gentlemen, we come to our main session is presentation from speaker. Presentation and discussion will be conducted by Mr. Eric Fernanda as a moderator. Mr. Eric is a PhD candidate from National Taipei University of Nursing and Health Sciences, Taiwan. Mr. Eric, would you please?
Okay. Terima kasih. Thank you very much, Bu Dewi, for the occasion and time and such a comprehensive introduction. Sebelumnya, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay. Since our speaker will be speaking in English, so let me to deliver my speech or my speaking also in English. Okay. Good morning, all distinguished participants. I am Eric Fernanda, and I will be responsible for moderating today's International Visiting Professor activity. The Honorable Vice Dean of Nursing and Health Sciences Faculty, Muhammadiyah University of Semarang, respectable the Head of Nursing Department of Master, Bachelor, Diploma 3 and Professional Nursing Education Program, the Honorable all lecturers of the Nursing Department and all participants of this virtual visiting professor activity. First of all, I would like to briefly state that today's activity is the first international visiting professor event held by the Nursing Department of Muhammadiyah University of Semarang. And this agenda is purposed to maintain the partnership and collaboration between the Muhammadiyah University of Semarang and the international sister school, including the National Taipei University of Nursing and Health Sciences, Taiwan. And we do hope more collaborations and can be established in the near future. And for your information, this visiting professor activity will be conducted in 4 series activity in different weeks in June and July 2022. And several speakers from Taiwan and Malaysia will be invited to deliver a lecture related to research, publication, issues and development in the nursing area. For today's lecture, we will have one speaker from Taiwan who will share us about instrument development, which is one of the considerable topic and methods for the international nursing publication. Alright, to begin today's lecture, let's invite our guest speaker, Professor Suvang Vivian Wu from Taiwan. Hello, good morning, Professor Wu.
Good morning, Eric.
How are you doing recently?
Very well, yeah.
Okay, welcome back to our university. If I'm not mistaken, you were here in 2019, right before the COVID-19 pandemic, right?
Yeah.
All right. Thank you so much for your time and willingness to attend our invitation. All right, Professor Wu, before we start listening your lecture, I will briefly introduce you to all of the audience. Mbak Olin, could you please help me to share the PPT? All right. Wait a moment. Okay. Try to summarize your CV, Professor Suvang, because it's a lot. So I think the participant could read it afterwards. Okay. Professor Wu is distinguished nursing professor and president at NTU NHS Taiwan. She received her nursing doctorate degree from the Queensland University of Technology, Australia in 2007. She has more than 10 years of solid experience as a director of the Research and Development Center and other academic director at National Taipei University of Nursing and Health Sciences. And her professional have been recognized by national and international institutions. In the past 3 years, she also received several international honors and achievements such as the 10th Outstanding Nursing Contribution Award in 2019, Fellows of the American Academy of Nursing in 2020, and also Stanford University names World Top 2% Scientist in 2020. Professor Wu is also well recognized as a remarkable author and researcher in precision healthcare, nursing experimental design, innovative educational models, and instrument development. She had written and published more than 150 papers in the International High Impact Journal in the past 5 years. Currently, she is also noted as a reviewer in the top international journal. So today's lecture topic is really fits with her expertise. We do hope we can gain a lot of insight from her lecture today. And for more information about her biography and presentation files, of course, we will share it afterward, or all of the participants can download from the link as shown on the screen. And for a short reminder, we will have a Q&A session or discussion session after the lecture is ended. All of the participants can ask the question directly to the speaker or just simply type the questions into the chat box of the Zoom control panel. And keep in mind, it is fine for all of the participants to ask or write the question using Bahasa Indonesia. Then I will help to translate it into English. All right, I will now turn the time and screen over to Professor Vivian Wu to begin the presentation about cultivate interdisciplinary talents for precision care and instrument development. Time is yours.
Thank you.
Bapak nama siapa? Ya. Sudah pernah berobat?
Erica, can you share my screen?
Yeah, it's so clear.
Okay, thank you. So good morning, ladies and gentlemen. Welcome to my presentation. I am Shufang Wu, but you can call me Vivian. Yeah. So hello semua. Yeah, my bahasa not good enough, but I also can speak satu, dua, tiga. However, I think I have been to Indonesia for many times, like some cities, Yogyakarta, Jakarta, Surabaya, Semarang as well. Sulawesi, Medan, Bali. Yeah, some of cities I have been to. It's a beautiful city and beautiful country. First of all, I would like to thank for your invitation. It's my great honor to be here and share with you my study experiences. The topic of my presentation is cultivate interdisciplinary talents of precision care and the instrument development. My presentation will focus on 5 parts. First of all, introduce my school and a research center, and then cultivate interdisciplinary talents for precision care. Finally, how to apply the theory into education or practice and instrument development. Now, I would like to introduce my school. NTUNHS is the only university focusing on nursing and healthcare in Taiwan, serving as a center for industry academic collaboration in healthcare. We have many outstanding performers with many only titles. It's the only university specialized in healthcare in Taiwan, and is recognized by international institutes, including QS Star subject ranking. Also, it is recognized by foreign and local governments such as MOFA, Africa countries to cooperate with the university, which make NTUNH as only designated university to cultivate the professionals in the healthcare field. The mission of our education is to cultivate top quality healthcare and nursing professionals who meet the needs of the global society. Our university has 4 colleges and 12 departments which focus on comprehensive healthcare of human life cycle. In other words, our education care the needs of human beings at the stages from womb to tomb. Our university provides multiple programs for training local and international nursing professionals. We have a complete academic program from bachelor to PhD degrees. From 2007 to now, our international nursing and midwifery master program has trained numerous healthcare professionals from our aligned countries. The total number of students of my university is more than 5,000, and half of them are nursing students. 100 students come from 26 countries. 90% of our faculty members are PhD holders. The university responds to low birth rate carefully, so the total enrolled students account for over 5,000 for each semester. About 1,500 new students are enrolled each year. We set up lots of professional labs to support the practical training. For example, Nursing OSCE Center, Gerontological Caring Lab, Speech and Audiological Lab, Precision Healthcare Talent Training Center. We also have many new learning environments from 2021. Our university has cooperated actively with advanced academic organizations in the US, Australia, the UK, Africa, and Asia, developing multiple cooperation. So far, we have trained many nursing and healthcare professionals in Taiwan, as well as from Indonesia and many allied countries. We offer students diverse opportunity to go abroad each year. We send more than 100 students abroad for short-term exchange program, international practicum program. We established partnership with more than 200 academic and industrial institutions from 20 countries. We are so proud of our students. One of our nursing students represented Taiwan to attend World Ski Competition on health and social care in Brazil 2015. The competition is quite competitive and won excellent prize. The employee rate is high. In 2021, our school overall graduate the employment rate is nearly 90%. APEC delegation and MOFA have visited our school many times to learn about our school's innovative medical and education model. In 2018, Speaker of Senate representatives of Brazil also visit our school. As you can see, we share with them 4 different themes from our school. In 2020, our school won the overall 5-star ranking by QS ranking. In 2022, our school is ranked 112 in the world for nursing discipline by QS ranking. Then, now I'm going to introduce a research center of our university. We established a research center in 2016. This is Taiwan's first research center featuring precision healthcare and smart care as its main focus. The vision of the research center are to provide innovation in the healthcare industry to improve people's well-being. 3 tasks of the center are research, consulting, and training. The research function, a dual-core research team works at interdisciplinary cooperation. One is precision healthcare, and the other is smart care technology application. Now I'm going to talk about research collaboration and how to cultivate interdisciplinary talents for precision care. You can see this progress of development of precision health. Okay, 2015, U.S. President Obama's State of the Union address announcement the Precision Medicine Initiative and invest $250 million to support. Since then, it has brought explosive change in the way patients care for, and make precision become a new trend of international medical research in recent years. So this page is about the definition of precision medicine, precision healthcare, and precision drug. What is precision care? It's different from traditional care. Here, compare the differences between traditional care and precision care. Over the years, our research center has developed precision healthcare and identified the conceptual and operational definition, which have also been published in Taiwanese and international journals. The definition of precision healthcare is a multi-integrated care model based on an interprofessional cooperation team combined with personalized medicine. So precision medicine focuses on the correct diagnosis and treatment of the patient's disease, but precision care is priority-directed care that focuses on patient health concern. Okay, so you can see our university aligned medical institutes, including NHI, to do some research cooperation of precision care. Our research team has found and summary the 6 P through literature review. They are health ideal goals, care preference, patient priority direct care, interpersonal collaboration practice, big data and biobank, and science of cell management. So 6 components of, if you can do that, we can call you doing the precision healthcare. That is our finding. Okay, so this article are about precision healthcare, which we have published in recent years, maybe 3 to 5 years. And by the way, I think Satria online here. Satria contributed a lot. Actually, Satria is one of the best students I have ever taught. In the field of precision healthcare, he is developing with me and is an outstanding research partner. I'm so proud of him from Indonesia. 2020 to 2022, with these 2 major research axes of precision healthcare and smart care technology application, we have published a total 97 articles. As you can see, the next page also in the 97 articles. And we cooperated with medical institutions to study a total of 24 cases. Here are professor research team in our research center. This research center, the researchers interested of precision team, including IT, knowledge discovery in database, health coin with blockchain mechanism, nursing, medical and health big data processing, and disease precision model. Researchers come from different countries and they have their own research interest. Yeah. The research center established powerful and diversified partnership to share research resources, conduct academic exchange, and establish research outcome, promotional models. They are also scholars from the University of Washington and the Chinese University of Hong Kong and Sapporo University in Japan. This page shows academic exchange with international benchmarking institutes during 2018 to 2019. Let's move on to the training function of a research center. We wrote a project proposal and obtained grant so that the facilities and equipment subsidies come from the government. We got the project established an industrial elite training base, only 8+4 and only 8+12 bases exist in Taiwan. So in our university, this base is quite precious and very tough to get that. We have brought in Australian aged care vocational certification course. The course content and credits are as follows. Course structure and way to teaching train-the-trainer program are as follows. We have some equipment is quite updated in recent year. Precision Healthcare Parent Training Center, like this one. The course is joint conduct with 4 colleges and universities. Lots of students signed up and passed the evaluation to obtain the completion certificate. We also have institution hold courses. Curriculum design combine industry visit, lecture practice, and comprehensive assessment. The follow-up development of function-oriented course will share the digital technology of my country's care service with partners in the Asia Pacific region. Okay, let's turn to the function of consultancy. We are serving as policy-making consultant for the MOE and MOHW. We have done a lot of government from past to present. We are completing vertical integration of curriculum planning in vocational and general senior high school, college and universities, and continuing education. Our future cooperation model, including to co-establishment of research team, conducting international research and publishing. We are continually integrating the research center and medical center and cooperating with top research center worldwide to share research resources, conduct academic exchange, and develop innovative research outcomes. So that is our school university briefing. Now I'm trying to turn to how to apply a theory into education and clinical practice. I think we are know that we are, especially in Taiwan, we are enter an age of aging. The population will shift from naturally increasing to naturally decreasing in Taiwan. The birth rate is very low. Then the birth rate is lower than the death rate this year in Taiwan. It came much earlier than predicted. Taiwan became an aging society in 1997 and its project to become an aged society. Now we are here in 2020. After another 5 years, we will enter the super age society. At that time, 1 in 5 is the elderly. That is our have to face problem. 1961 population like Leighton However, 2061 population in Taiwan tasked the share of an investor bill. Yeah. This table is the top 10 leading causes of death in Taiwan in 2016. 80% of cause of death are chronic disease such as heart disease, cardiovascular disease, stroke, and diabetes. The report points out that half of Taiwanese elderly people have more than 2 chronic diseases. Persons with chronic disease must achieve a balance between daily life and disease. They must learn self-management of disease and maintain a stable daily life. Self-management as persons with chronic disease engage in health promotion behaviors and bearing the responsibility for managing their daily life. In 2001, Lori published a study of CDSMP group. They contain members who were 40 years of age or older with heart disease, lung disease, stroke, or arthritis. I think the report, okay. Yeah, WHO website featured LORIC and program and initiated that stem from the CDSMP model. Even though patient education is widely promoted in Taiwan, there remains a doubt about how effective patient disease control. The traditional patient education is only to change knowledge through information transfer. This is not sufficient to achieve the desired outcomes. Diabetes self-management is a concern because it is assumed that adopting a healthy lifestyle will produce better metabolic control of diabetes. This will help to avoid complication of the disease. American Diabetes Association recommends all people with diabetes should receive DSME. DSME, also called Diabetes Self-Management Education. DSME is a critical element of care for people with diabetes and is necessary to improving patient outcomes. DSME are the essential function for the empowerment. Dr. K. Lori, is very famous researchers in America. Dr. Lori came to Taiwan 2015 and shared her study experiences, and we had a discussion together. I brought my graduate student to share and to publish our research outcome. As you can see from this figure, self-efficacy actually a mediator between self-management and self-care. Because we have many students here today, so I will use many figures and the table to explain a model or a theory and how to apply the model to education or practice. This slide shows the consequence of self-management support for people with chronic disease. Actually, I did a study and published a paper in 2016. The result has been shown self-efficacy was an important mediator between knowledge and self-care behavior. After I tested the model, I can give you example. Here is research framework of my paper. Self-efficacy here was a crucial, very important mediator between knowledge and self-care behavior. It's this article. So you can see this article. We mentioned the mediating effect of self-efficacy on knowledge and self-care. So the result and the relationship between knowledge and self-care was fully mediated by self-efficacy. So I will introduce what is self-efficacy theory. A model of self-care is the framework for my study, but the basic premise of the model comes from Bandura's work. This picture is the best explanation for self-efficacy. Actually, self-efficacy is a kind of self-confidence. Dog say that I'm confident I can maintain my sitting position when the cat walks past the dog. So it's a kind of self-efficacy. So here is the definition of self-efficacy. And this postcard was written to me by Bandura. Now Bandura have already maybe 90 or 90 years old. Yeah, but he is very, very famous. Is a very good scholar. Let me explain the self-efficacy theory. This theory had two main components: efficacy expectation and outcome expectation. Both these two expectations are important determinants of behavior. For information sources here could enhance the efficacy expectations. The higher self-efficacy, the higher motivation to perform behavior, and this will produce better outcomes. So this model is a self-efficacy model. Four information sources are applied in the intervention of my study. One is performance accomplishment, and like also mean practice and earlier experience. This is the most effective in developing one's self-efficacy. Two is vicarious experience, learning from others who perform tasks successfully. This is the second important source. Verbal persuasion also means receiving positive or verbal reinforcement from others. This is the most often used, but it is also weaker than other sources. And finally is self-evaluation, provide feedback to the person of how well the task is being performed. So this slide, we see the self-efficacy model again, but how to apply it. So this slide shows measurement of self-efficacy when we want to apply to diabetes management. Two diabetes specific instruments, including BMSES, used to measure efficacy expectation, and the PTES used to measure outcome expectations. SDSCA is used to measure self-care behavior. Health outcome may include quality of life, psychosocial well-being, and the cost of health care. Okay, so now I have been doing research on self-management of chronic disease for more than 20 years. My research history is divided into 4 stages, including establishment, evaluation, promotion, and continued expansion. Today's topic only focus on the stage 1, the establishment. So here is my research population and my research concept formation. The population of my research include diabetes, metabolic syndrome, osteoarthritis, CKD, stroke, some chronic disease. I would like to thank the excellent cooperation from IPIS team members for their generous information and support. International partners in self-management and empowerment is called IPSE. We cooperate research together. The members of IPSE are in different countries, so Taiwan is me to in charge and respond. I really appreciate Professor Lily. She may be at the, maybe she told me and guide me a lot. Current attention not only develop the intervention, but also develop a very instrument to measure cell efficacy and cell management. That have been and remained an ongoing challenge. We have a little bit concern in test project with some scholar from Netherlands and work with Dr. Lorik. I usually encourage students to participate in international research teams and will have more opportunities and resources in the future because that is my personal experiences. Okay, let's turn to the two-stage study design, which include translation and validation stage. So the establishment, the main purpose to test the theory and developing an instrument when you want to apply to diabetes. I just use this case to explain. So this is my first very early study. Stage 2 is to develop an intervention program based on a cell efficacy model. Study 3 is to test the effect of a cell efficacy intervention enhancing program. This slide again. This slide shows the cell efficacy theory and its application. DMSES instrument is used to measure cell efficacy. Here you can see some publication related to my step 1 study, developing instrument and testing theory, especially to diabetes-specific cell efficacy instrument was developed. So some scholars or some student research, they asked to use this instrument. I will free and give them to use. I will give the consent form. I will give agree for them to use this instrument. So what is two-stage study design, which includes translation and validation process? The aim of this study is to translation, test validity, and reliability of DMSES in a Taiwanese population. Research questions follow the previous objective. As a scale are developed in the basic of a specific set, concept, or application to a specialty population, great care must be taken in the translation in different languages, in particular by people from different cultures. Only after pass through an integrated process of repeated translation and reliability exam can they be regarded as an accuracy research tool using a Breitling revised translation model to overcome cross-cultural differences, because I translated from English version to Chinese version instrument. According to Breitling model, the translation procedure can be divided into 6 major steps. Table 1 shows summarize the key points of the 6 steps. The process includes pre-translation group discussion, reply translation, and pre-test. A scale for translating different language can be considered a new version of scale. The same scale will produce some result due to cultural differences. For example, Chinese people often miss the problem or just skip some difficult questions. In addition, Japanese and Chinese like to choose 3 points in the 5-point method because it is a natural score, while Americans prefer to choose a very high positive source, such as 5 points. So here is the translation process, which includes forward translation, consensus meeting, focus group, and backward translation of the instrument. After translation, a pilot test was done. Before the test, the psychometric properties of the Chinese version of the DMSES. A convenient sample size used to recommended ratio of at least 5 participants for each item. So DMSES has 20 items. I used 10 participants for each item, so that the sample size was at least 200 participants. This study was conducted in a teaching hospital in Taipei City. The advancement is in an outpatient clinical. Contact and screen whether participants meet the inclusion criteria. If so, participants were invited and asked to sign a consent form before they fill in the questionnaires. 2 weeks later, a random sample, about 30 participants were asked to fill in the same questionnaire. Many instruments were used in the study, include cell efficacy toward management of type 2 diabetes, measured by DMSES. SD-SCA is used as an instrument for the criterion validity. GSE, general cell efficacy, is used as an instrument for the convergent validity. Data analysis include Pearson correlation, regression, compound alpha coefficient factor analysis. So here are the results. 230 participants' data was analyzed. The mean age was 63 years, with a diagnosis of having had diabetes on an average of 8.6 years. I think expert judged the content validity of the CDMSES. CVI was 0.86. Expert also accept the wording change during the previous translation stage. According to Bandura, cell efficacy is the most important predictor to change in behavior. CDMSES was a significant predictor of diabetes self-care behavior using a regression analysis, accounting for 34% of the variance in the total SD-SCA scores. In order to examine whether the CDMSES, C is called Chinese version DMSES, is valid in the cell efficacy domain, GSE was selected to provide convergent validity for the study, and the Pearson correlation coefficient revealed a positive association. So CDMSES and GSE reveal a moderate association. So it's positive correlate together. Based on the result of principal component factor analysis, 4 factors had been found and had the eigenvalue greater than 1, explaining 68% for the total sample variant. And the other good result is good internal consistency were found, compound alpha from 0.77 to 0.93. Test retest was calculated using a Pearson correlation, and result was 0.68. The ICC was 0.82. Overall, we found that convergence and criterion validity of the CDMSES were supported. Reliability and stability of the CDMSES were similar to result for the English version. Okay, so we still have time, so we talk about a cell efficacy enhancement intervention program, how to design an intervention for chronic disease patient. For example, the intervention suite of SEEP, SEEIP, we call cell efficacy enhancing intervention program, include viewing a 10 minutes DVD, receiving the diabetes self-care booklet, participating in 4 weekly efficacy enhancing intervention sections, and telephone follow-up. 4 information sources are applied in the SEEP intervention. Different interventions use different information sources. The booklet shows real stories of patients who have experienced their difficulties and encountered different problems. This situation was used as prompt question in the booklet to promote discussion. Like example, week 1, receiving the diabetes self-care booklet. One of the diabetes patients was used as a role model. Uncle Asparagus successfully used self-care activity to prevent acute and chronic complications. So the other is week 1. We also viewing a 10 minutes DVD. And here, 4 cell efficacy enhancing intervention sections were undertaken. Each section to promote cell efficacy enhancing skill, fostering goal setting and sharing and deep peer support. In order to conduct in this intervention, the researcher was trained in counseling skill in Australia and Taiwan and received the appropriate certificates. And then I can, as a leader, to conduct these 4 sections. This slide shows nurses have attended a training program and get certificates. Week 1 to week 4, participating in 4 weekly efficacy enhancing intervention sections for diabetes patients. We also contact the participants by telephone after the commencement of the intervention program every 2 to 4 weeks. Week 8, after the commencement of SEEP, telephone follow-up. So it's easy to understand. If we want to change patients' behavior, we should let them know and they want to do. So it's a attitude. So if it should be, it's up to me. Only patient can manage their own disease, manage for their daily life. So that is the conclusion I would like to say for the total cell efficacy model and how to apply. So it's the word. If it's to be, it's up to me. So finally, I think lots of model or lots of you want to do something, you don't need to feel very difficult. I think impossible will become I am possible. So this is the end of my presentation. Thank you once again for your attention. Thank you.
All right. Thank you very much, Professor Wu, for your remarkable presentation. And actually, I also learned a lot from your presentation. And before we continue to discussion session, maybe I will let you take rest for 1 to 3 minutes, maybe drink water first or something like that, because I would like to try to summarize in Bahasa Indonesia about your talk today, because maybe some of our students have a weakness in listening in English presentation. So let me briefly summarize your speech or your presentation. Jadi Bapak Ibu mohon izin untuk menjelaskan dalam bahasa Indonesia terkait dengan presentasi dari Prof. Wu tadi. Jadi sebenarnya tadi presentasi dari Prof. Wu itu adalah perjalanan panjang karir riset beliau begitu ya, sehingga sampai kepada salah satu step penelitian yaitu tentang pengembangan instrumen. Jadi tadi sudah disampaikan di sekitar tahun 2016 atau 2015 bahwa NTU NHS itu sudah membuat atau membentuk research team gitu ya, yang tadi banyak sekali anggota-anggotanya. Kemudian Profesor Wu menemukan bahwa self-efficacy theory itu bisa menjadi mediating effect atau efek yang mediasi antara knowledge dan outcome. Nah, karena banyak sekali tim research di research center tersebut, ada yang chronic disease, ada yang kemudian fokus diabetes, cancer dan sebagainya, sehingga tim tersebut itu membentuk bagaimana caranya self-efficacy ini itu bisa digunakan untuk riset selanjutnya. Contohnya untuk mengetahui kemungkinan bagaimana cara untuk mengetahui misalnya bagaimana caranya memprevent atau supaya diabetes mellitus itu tidak berkembang menjadi sesuatu yang buruk. Nah, untuk mengetahui itu perlu dilakukan studi observasional misalnya, maka harus ada instrumen yang dibutuhkan. Nah, karena beliau tinggal di Taiwan, mungkin tidak tersedianya instrumen-instrumen dalam bahasa Cina atau bahasa Mandarin, atau paling tidak ada instrumen-instrumen yang bisa mengukur konsep tersebut tadi, sehingga sampailah pada tahap perlunya pengembangan instrumen tersebut untuk digunakan di penelitian selanjutnya. So it's very important to develop the instrument finally. So tadi Profesor Vivian sudah menyampaikan juga bahwa banyak sekali metode yang bisa digunakan untuk mengembangkan sebuah instrumen untuk bisa digunakan dalam penelitian-penelitian atau penelitian bisa observasi atau penelitian untuk mengetahui evaluasi penelitian intervensi gitu ya. Salah satunya adalah dengan metode translasi atau translation instrument, begitu tadi, yang paling mudah. Jadi tadi beliau mencontohkan beberapa example atau contoh gitu ya, bagaimana cara mengembangkan instrumen yang paling mudah, yaitu dengan mencari instrumen-instrumen yang sudah ada sebelumnya, kemudian digunakan kepada populasi Taiwan, sehingga perlu untuk dilakukan translasi. Nah, ternyata proses instrumen development atau pengembangan instrumen tersebut yang tadi dalam proses translasi dengan step yang berbagai macam step cara tadi ya, dari mulai translasi, kemudian tes validitas dan reliabilitasnya, sehingga bisa di-apply-kan atau digunakan dalam riset, itu ternyata bisa digunakan sebagai publikasi ya. Jadi kalau kita kan biasanya fokusnya penelitian ya, kalau nggak observasi kemudian intervensi seperti itu ya, intervensi atau efektivitas dan sebagainya. Nah, ini ternyata ada salah satu metode yang bisa digunakan untuk kita bisa publish atau menerbitkan manuskrip kita di jurnal-jurnal keperawatan dengan cara atau metode pengembangan instrumen tadi, gitu. Secara garis besarnya seperti itu. Alright, Professor Wu, I was trying to translate your presentation into bahasa Indonesia. Hopefully our student can understand, and I also have several questions in my hand already, but I would like to ask the audience first. If you like to ask your question directly to Professor Wu, please, I will give a chance to you all. You can raise up your hands.
Moderator,
All right.
Mr.
can I
Satria.
ask one question?
Okay.
Professor Wu.
Okay. Satria would like to ask a question.
Okay, good morning, Professor Wu. Thank you very much for visiting in our university, Professor.
Let me see your. Oh, okay. Mr. Sri, yeah. Oh, you are in the middle. Okay. Good.
Yeah, my great honor, Professor Wu, my advisor, my teacher, my mentor, person who has influenced me a lot, Professor. Thank you very much. And thank you very much. You teach me patiently when I was a student in NTUNHS. I'm so glad to have you here, Professor, and I believe majority of people here also feel the same thing as me here. I have one question, Professor.
Yeah.
About the instrument development.
Mhm.
I really want to conduct one study about the instrument development for assess pre-diabetes, Professor. Pre-diabetes. Because
Pre-diabetes. Yeah.
pre-diabetes, yeah. Because every year we can, as long as we know the number of population with diabetes in Indonesia always increase every year. And if we can find patient with pre-diabetes in the first stage, maybe we can decrease the number of population for diabetes population in the future. So my question, what I have to do in the beginning phase to conduct study about the instrument development, Professor? That's my question. But I have honestly, I have personal interest, Professor, because I think I have to talk to you. I really want to go to Taiwan.
Yeah.
For
Welcome.
expressing my thanks to my professor there, especially for you. But the pandemic situation like this not support me, Professor.
Next
I hope.
time. Welcome.
Yeah, I hope
come back.
if COVID-19 disappear, I will go there to thanks
Okay.
to my professor there. Thank you very much, Professor Wu.
Yeah.
Thank you very much, moderator.
Okay, Satria, thank you. So I think your suggestion and comment is quite good. Actually, my study also include pre-diabetes population. But if for instrument is appropriate or not very suitable for pre-diabetes, you have to see, because the DMSES is for have been diagnosed diabetes. But if you use the population of pre-diabetes, you have to test the instrument again. Maybe you choose maybe 30 participants to test, because I am afraid the item of DMSES not very totally suitable for pre-diabetes. But we need to do something to delay a patient from pre-diabetes become the true diabetes. So your intervention had to be earlier to conduct in this population. I think in Indonesia also lots of diabetes patients in your society. So if you can use your no major intervention research study to pre-diabetes, I think that is a very good idea for you. And in Indonesia, yeah, you can delay, and then you can prevent patients who have diagnosed become a diabetes. So Satria, I support for your research idea.
Yeah, I hope in the future you can join with our research in our campus, Professor.
I think very soon, because the COVID-19, we maybe successfully to come we will win this COVID-19 world. Yeah, so next time, no matter you came back to Taiwan, or maybe if you have opportunity, I will go to Indonesia.
Thank you. Once more, Professor, can I ask one more question?
Yeah, of course. Sure.
In November, we will you can speech. Maybe 15 minutes is okay, 30 minutes is okay, Professor. As keynote speaker, please.
November?
November.
Another seminar.
Yeah, symposium, international symposium, Professor.
Yeah. If I have my schedule is available, I'm happy to do. Yeah.
I will discuss with Mr. Justin.
20 minutes. Yeah. Okay.
Thank you.
Thank you for invitation.
Okay, Satria, did you get the answer or the response from Professor Wu already, or you still have something to clarify?
I will discuss maybe privately with Professor Wu. I think it's better.
No, I mean for the questions that you have asked. Is there something that you need to clarify?
Yeah,
No.
it's clear. It's
Okay,
clear.
okay. So we
Thank
will
you.
continue with the second question. I see Mrs. Dwi Nur Rahmantika is raising her hand. Please.
Okay, thank you, Mr. Satria, for the chance. Hello, Mr. What can I call you?
Professor Vivian.
Professor Vivian. Yeah.
Yeah, you can call me Vivian. Yeah.
Okay.
It's easy.
Okay, nice to meet you. It's a great presentations. My name is Tika, Professor. I wanna ask some questions related to my future's research. I want to develop the instrument about the CPRs in the students. And then the previous instruments was developed for the clinicals. And then I want to develop in the students area. The first question is about the number of sample size. You mentioned before in your slides that the suitable number of the validation samples is about 200. Is that the fit number, or it can be decreased based on the populations in our area? It means it can be only 100 or above. It's not until 200, or it must be 200 or above. And then the second question is about the expert judgment. In your research, you involve about 8 expert judgments. And for the, especially for me, how many expert judgment that should be included in my research when number of the expert in CPR on the Indonesia or in my area is not too much. That I think that's all from my question. Thank you, Miss Prof. Vivian.
Okay, let me clarify again your question. So you are asking about you gonna develop your instruments that previously developed for a clinical nurse,
Yes.
and you will apply the instrument to nursing students. Is that?
Yes.
Okay.
Yes, that's right.
Okay. And number 2 is about the sample size. Is it correct?
Yes.
Yeah. Okay. So Professor Vivian, you get the question already?
Yeah.
And then the last is judgments, number of the
Okay.
judgments.
The number.
How many expertise in the CPRs that should be included for my research? It should be same with the Prof. Vivian's age, or it can be less than that number.
Okay, thank you for your question. I think 2 very good question. You are doing a research study, right? At the moment. Can I
Yes.
ask, this instrument you want to develop is for clinical nurses, and how many items in your instrument? This instrument, how many items?
The item is 18.
18. Okay.
Yes.
So we usually, if you don't use the G power to calculate the sample size, you can use a very easy way to calculate how many participants you should collect.
Yes.
So if 18, at least each item, at least 10 participants.
Oh.
In other words, if you have 18 items of your instrument, this scale, you have to collect data at least 180
180.
That is safe, and you can you can get a very good result for validity or reliability. Because if sample size too small, it maybe is very good efficiency for the power calculation. So the sample size is quite important. If you can collect data to 200, I think it's safe and very good.
Okay.
When you want to when you find the result, it's really good. So that
Yes.
is very important for the sample size for you want to develop an instrument. The other question is how many experts to do CVI content validity, or we call expert validity? At least 5. But the important, what background of the expert you want to find is very important. If you want to develop a clinical nurse instrument scale, something like that, how do you think the expert, how background of expert you want to invite? Maybe
Okay.
nurse, you have to invite nurse or nursing teacher or hospital, some people, some scholar, they are very good researchers related to clinical nurse. So you have to invite very good background and related to your instrument which you would like to develop. So 5, it's better to use the number and odd number, 5 or 7.
Okay.
5 or 7. My expert, I choose 8. It's not really good because odd is good. not yeah. So 5
Yeah.
or 7, okay?
Okay.
Yeah.
Okay. Thank you for
Okay.
the answers.
So following the Miss Tika's question, is there any basic specification for the education maybe for the expert? It should be
Critical
Post-
or emergency lectures.
yes, or it should be graduate from master degree minimum, or a doctorate degree, something like that, Professor, for the expert.
Expert.
Yeah.
Yeah, you mean
No, I mean if we would like to do expert
I think
validity.
if scholar, you may find maybe very good publication, lots of related to that field. But I think not. If you find a nurse is very good experience for clinical, not you no need to ask their degree. No need. They have experience more than 5 years. You can invite it into your expert team. But scholar, you
Yes.
have to find he or she did publish lots of related to your instrument topic.
Okay. Prof. Vivian, I'm sorry. For the backgrounds, this instrument will be used in the students' levels. It's not in expertise, so that the expertise that will be involved in this research, it should be lectures.
Lectures.
It should be lectures, so that 5 expertise is the background is lectures, not the clinical. Am I right?
I think it's the same. Yes, Professor. I think Mrs. Tika said that she is planning to maybe choose the lecturer to be an expert. Is that okay? To do that?
If this lecturer, she is also the expert for this research field, I think it's okay.
So it's depend on the expertise of the expert, Mbak Tika. So you
Yes.
should find expert on the CPR, no matter a clinician or lecturer. It could be fine to be
Okay.
a part of the expert judge.
Expert judge. Okay. Thank you, Mr. Arik and Prof. Vivian.
Okay. Next question, Professor Wu. We have two questions from our master students, because we have also nursing master students in our university. So I'll try to translate it into English because he write it in Bahasa Indonesia. So actually, he was conducting a research. Wait a minute. Okay, he is asking about how to develop the instrument from the thesis, because he was doing a thesis before, and it's about scoring the pain in the diabetes neuropathy. You got it? It's a scoring for the diabetes neuropathy pain, but he was using the general scale. It's called VAS, Visual Analog Scale, which is not really for pain in neuropathic diabetes. So he would like to plan to conduct another instrument development to really score or measure pain in neuropathic diabetes. So what first step that he should do for that instrument development?
Before thesis? So she is writing up a thesis.
Yeah, writing up the thesis. After the thesis,
degree.
yeah, and for another research. Previous,
But this research study is for her thesis, right? Or different two things?
I think for thesis. So what is the first step that he can do? Because previously he did scoring the pain for the neuropathic diabetes using the general VAS instrument or visual analog scale. But next research, he would like to develop the instrument that specifically measure the pain for diabetic neuropathy. So should he find existing instrument or something like that for the first step?
Yeah, my suggestion, because master degree, only master degree to get, maybe we need to spend 2 years, right? So if you want to conduct a research study, for example, experimental research design, experimental research design, before you conduct an intervention program for your study, you have to choose, because you have to choose the suitable scale to focusing on your concept or variable you want to do. So if you can find a Bahasa Virgin instrument, it's very good, except you cannot find Bahasa Virgin of instrument. So you have to develop a new or translate from other countries' instrument. Otherwise, I suggest you just choose a suitable and already have some people already translate in Bahasa. It's easy to conduct your main study. If you want to develop a new instrument, maybe you need to spend more than 1 year. So
Okay.
it's to spend to waste time for your study progress.
Oke, so Mas Hendra, kalau mungkin belum boleh saya menambahkan dari penjelasan Profesor Wu tadi, beliau menanyakan bahwa ini penelitian selanjutnya ini apakah untuk tesis atau penelitian apa gitu ya. Kalau untuk tesis, karena keterbatasan waktu, jadi beliau menyarankan jika ingin fokus ke pengukuran nyeri untuk neuropati diabetes, begitu. Jadi beliau mensarankan untuk mencari instrumen yang sudah ada. Jika instrumen yang dicari kalau ada yang dalam bahasa Indonesia lebih bagus, tetapi kalau misalnya tidak ada, silakan cari mungkin dari pengembangan instrumen-instrumen yang sudah ada di publikasi luar negeri begitu ya, dan bisa dikembangkan dengan menggunakan metode translasi tadi. Nah, itu akan lebih cepat, karena kalau misalnya mengembangkan dari awal itu akan membutuhkan waktu kurang lebih 1 tahun begitu ya, karena harus kualitatif studies dulu, kemudian membuat item satu persatu, kemudian diujikan baru bisa digunakan gitu. Jadi jika penelitian tersebut digunakan untuk tesis karena keterbatasan waktu gitu ya, karena biasanya master itu cuma 2 tahun, 2 tahun 3 tahun begitu. Jadi lebih baik mencari dulu instrumen yang sudah tersedia di publikasi-publikasi luar misalnya ya, di negara-negara lain di luar Indonesia begitu. Jadi jenengan bisa develop dengan menggunakan metode translasi tadi. Gitu. Gimana Mas Hendra? Bisa dipahami ya?
Bisa Pak, terima kasih Pak.
Ya, baik. Next question is from our offline students because some of students were in the same room with the Satria's room right now, and one of them would like to ask the question directly to you. So please, Mbak Asih. Halo, ada Mbak Asih?
Hello, Prof. Wu. I am a student from Bachelar Nursing. I have a question. Prof. Wu, based on your experience, what challenge for publication in instrument development? Thank you.
All right. She is asking you about the challenges to publish the instrument the development methods in international publication, for example, like that. So what is the challenge? Maybe you face so many rejection or something like that, or whatever.
Wow.
you could share, yeah. You could share about that to our students so they can anticipate that.
Yeah. So it's very good question. Yeah. So very good question for student. I think if we want to publish a paper in international journal, you should prepare your mental health because maybe at the beginning you will be rejected. That is normal process. Don't be frustrated because many times I have been to reject before I still now. When I want to publish a paper, also I need to face this difficulty. But I think if you try and then revise, the reviewer is our good teachers, because if he or she give us some comment or suggestion, you just to revise and then submit again. If this journal they are not really happy to accept your paper, you just resubmit it to the other international journal. So that is the process, normal process when your paper, when your draft manuscript have been rejected. It's really normal. Yeah, I usually face to this difficulty as well. Yeah, but don't be frustrated. You have to continue to do your study and continue to try to publish your work, your research work. Remember, don't be frustrated. You just try again. Yeah, finally you will succeed. You will successfully to publication. That's all. You will find it.
Ya, gimana Mbak Asih? Bisa dipahami? Okay. She got your response, Professor Wu. And then we have another question from Konkan University. So there is an outsider participant from outside of our Muhammadiyah University of Semarang, and she's asking about, because she not quite familiar with instrument development, so she is asking about how many experts do we need for the translation process. I think the other question is been answered with the previous discussion with Mbak Tika. So I think this question is need to be answered. So how many experts do we need to do a translation process? So it's only 2 or 1, it's enough? Right.
You mean translation
Yeah,
process?
for the translation, not for the
Yeah.
expert judge.
Yeah, I think need to at least two, and this two translator scholar should be bilingual expert, bilingual. When we want to do the translation process, you choose two scholars who are familiar with instrument, and also he or she is bilingual scholar.
So
For
is
example, he or she can very familiar with Bahasa and maybe English and Bahasa.
okay.
Bilingual, yeah.
So it also need to be like, for example, she would like to develop a nursing self-efficacy scale, for example, like that. So it's mean the translator is also need to be recruit from the nursing, or only someone who available to translate, or available to or expert into bilingual.
Only for language.
Only for language. Not
Yeah.
no need to be expert.
No need to this clinical field for this
Oh,
topic.
okay. So it is fine if we, for example, drop our questionnaire, like foreign questionnaire, to like English department of English language department center, something like that. Is that fine?
Yeah, but I suggest not only find maybe not find an English teacher. If you can find a nursing teacher who are familiar with Bahasa and English, that is a very good choice to invite him to be a translator, because she can do very well language translator. Also, she or he can very familiar with this nursing field. That is easy and then accurate for your translation work.
Yes, that's the problem. If we recruit the translator from, for example, a general language teacher, English teacher, so sometimes the term is really different. So it's suggested to recruit a nursing or bilingual.
If he or she can invite like Eric or Satria, maybe it's good. you can ask the translator, for the process they want to conduct.
Okay. Another, do we still have a time, Bu Dewi? Pak Satria, do we still have?
Yeah.
Okay.
Yeah.
Because
Yeah,
we still
masih,
have a two.
Arif.
Yeah, we still have a two question from the chat box, Professor Wu. It's from Kurota Ayun. I think they are very interesting with your presentation today, and try to have an insight of in their mind to I need to develop the instrument development next in the future. So that's why they are very interesting and ask a lot of questions to you. So I hope you can respond them very well. So next question is from Kurota Ayun. She is actually alumni from Unimus, and she would like to thanks for your sharing for your research. And previous research in bachelor research, he was conducted a research about the diabetic ulcer and one of the complication of the diabetic mellitus. She would like to ask about can she use your instrument in the patient with a complication from diabetic mellitus? I mean the DSMSE, is that? And what important self-behavior that we can give advice to the patient with the complication of the diabetic? So that's the questions. Maybe you can answer.
Okay. So in my opinion, I think because you're doing the research about the diabetes complication, like diabetes foot and then ulcer, and they suffer from complication. You mean the diabetes ulcer patient, the population, but this population I think it's focusing on maybe wound care or some prevention for complication become a diabetes food. So if you want to use DMSES, they have 5 components in this instrument, which is I think nutrition component, and the other one is food check, and also for diet, for exercise. They have 5 components. So if you want to do, I think this instrument you have to. I can give you my instrument, and then you find the item and the question. Is it suitable for your study population? You have to judge by yourself, because in DMSES have 5 components I mentioned: nutrition, exercise, food check, and then one is for blood test, blood sugar testing. So if you see the whole questionnaire, I will send to you, and then you will judge by yourself. If you feel you can use this one as an instrument to measure your variable of study, and then you can use. But I will give you my questionnaire, and then you try to use.
So actually, it fits for to measure her research population.
I can free to give you use. Yeah, it's no problem. But if the instrument is suitable or not, you have to judge, because I don't know the total the whole project name and the whole project purpose for your study. I'm not really understand. So depend on what variable you want to test.
Oh, okay. Maybe the best suggestion is maybe let her to email you later to explain about the purpose of the study, something like that. So you might give her some advice whether the instrument is fit or not. Is that okay?
Yeah.
Alright.
Exactly. Yeah.
So Mbak Kurota Ayun, nanti dimohon mungkin bisa email beliau ya untuk menjelaskan mungkin tujuan penelitiannya seperti apa dan sebagainya, yang mau diukur seperti apa, sehingga nanti beliau bisa memberikan saran apakah instrumen tadi fit atau tidak, atau cocok atau tidak untuk mengukur tujuan penelitian dari Mbak Kurota Ayun. Gitu ya. Okay, I think that's Professor Wu, and we also have a question from our lecturer. Our lecturer from nursing department. It's from Mrs. Trinur Hidayati, and she is asking about how to develop instrument with the different cultures in Indonesia. You know that we have more than 1,000 culture. Like I think it's the same with China or Taiwan. So I think it's very challenging. So when an instrument has been developed, how long it can be updated? So it need to be updated every year or something like that. If, for example, I'm doing instrument development this year, and I will use it in my research right now, and then after 2 years I would like to use it again. Do we need to update every year, something like that, or how long it can be updated?
Only one. Yeah, if you want to translate or develop a new instrument, I think yes, different country or different region, different area have different cultures. Yeah, of course. But I think, for example, my questionnaire DMSES, I try to translate from English version to Chinese. We find in Taiwan, HbA1c, we 3 months, every 3 months can check the blood sugar for HbA1c. So 1 year, 4 times to check. But the English version, they suggest every month to check. So depend on Taiwan's culture or Taiwan's health insurance regulation. So I I change to 4 times per year to check the HbA1c. Something like that is an example to tell you some very big very big problem or very big issue. You just to adopt it into Indonesia version, something like that. But if very small, I think you no need to change too large part of the different from original, because if you change a lot, that is total different from original instrument. They will influence to validity or reliability. So you cannot change very big.
Okay.
And you only revise in the very early the first step. No need to every year to revise. No.
Okay, I think yeah, I agree, and it should be depend on the situation that we conduct the research. Right? Yes, Professor. For example, in like condition in Taiwan, like it needs to be measure every 5 times a year, so it should be modified. So yeah. Okay, I think one of our offline participants is also like to ask the questions. Mbak Olin, you still remember Olin, right? She was our master students in NTU NHS, was graduating last year.
Yeah. I think if you show your face, I can recognize.
Okay,
yeah.
please, Mbak Olin, could you please
吴老
ask your
师
question
你好
directly?
吗？
Yeah, 很好. Yeah, very happy to see you, and then it's very good. Yeah.
Okay. Professor Wu, I want to ask something. Actually, I have a story. It's my friend. Actually, it's my friend's story. She want to use a questionnaire from one of institution in US, and the questionnaire is only available in English. So she need to translate to Bahasa. And after she translate to the Bahasa, some of the question is not suitable with our culture. And then she asked me, can we delete some of the questionnaire, or maybe we can change the questionnaire? If we want to delete or change, should we need to ask permission to the original author from the questionnaire?
Oh, very good question. Because I forgot to mention this part. I think when you want to change one question is because it's not suitable for your country's culture. I think if you want to change a lot for this item, yes, you can change become Indonesia situation, but you have to inform the original version of scale, this author. You have to inform the author who developed an original version. You have to inform her or she or he. And then he agreed, and then he judged. No, it's no problem for the total validity or reliability. And then the original author, they will give you answer, because we have to change back to like original. We don't want to change a lot, but we suffer from question is cultural difference, maybe total differences. So you have to choose. You have to decide to change the item content. It's okay, but you have to inform the original author to ask, is it okay? Yeah. So you have to you have to do this.
Okay, Professor. If we change some of the question, should we do pilot study for the questionnaire?
Yeah, of course. And then you test in Indonesia population.
Okay. Thank 谢谢你 Professor.
不客气。
And also continue with the all-in question, because I also have same issues with my students in our universities also, and she would like to use self-efficacy for CPR, I think, and an original questionnaire, the scale is 1 to 100, and she would like to change or alter the scale into categories like 1, 2, 3, 4, and 5. Is that okay, or we should not alter the scale if you would like to use that instrument?
换它的次序。
Yeah, because I show the instrument is very weird, like it's consists, for example, 10 items, but the scale you have to rate between 1 to 10, at 1 to 100 for the self-efficacy. I think you ever heard about that, and then because it's very difficult for the participant to rate, and it's lead to bias, so that's why the students would like to change the scale into 1 to 5 scale, like Likert scale. Is that okay, Professor, to alter or modify the original scale from 100 scale to 5 Likert scale? Is that okay?
Okay. I think actually I don't suggest you do that thing, because one day your result will publish in international, and some people like some people do lots of, I mean,
citation.
No, because we will some secondary data analysis is very popular. So if like literature review or some scholar do meta-analysis for secondary data publication, they will find search lots of paper related to one variable, and then if you use the same instrument, we have to count the mean score or the higher score to do the comparison for each different country or each different study. Now, which study are published in different country. So that is difficult to, if you change the scale, Likert scale, like 1 to 100, you change become 1 to 5 Likert scale. That is totally cannot be compared with other studies. So I think I don't suggest you change the Likert scale. Yeah, in different.
All right.
Yeah.
Okay. And another students from our another question from our master students. Maybe you can also take a break, Professor Wu, if you would like to drink water. It's okay. Let's take it easy now, that formal. So another question from our master students is from Mr. Sharifuddin. He would like to know about how to apply the scoring of self-efficacy to the quality of life for the DM patient. Hello, Professor Wu?
Yeah.
Yeah. What kind of
you mean self-efficacy and quality of life?
yeah, how to apply the scoring of the self-efficacy to the quality of life of people suffer with diabetes mellitus, and what kind of a factor that need to be considered for the researcher to know the efficacy, the self-efficacy itself.
So you mean you want to know the relationship between self-efficacy and quality of life?
Yes, and another contributing factor that how to say that, influencing the self-efficacy.
Covariance.
Yeah.
Covariance by variable. I think I do lots of study related to self-efficacy and quality of life, and then we found the relationship is really positive correlate between these two variables. It means that the higher self-efficacy, the higher quality of life score. So we have already tested this model and then find the relationship between this variable. But what is the covariance? We have to control at least the age and then disease, and then disease complication. You have to control this covariance. That is very basic variable, covariance that you have to control.
Okay. All right. Okay. Another last question. I received a question from our lecturer from a nursing department. He is concerned about the sample size. This is a very hot topic that we usually discuss among the students and lecturer when we are conducting a research. Actually, how many sample that we need to do or conduct the research in this topic? Because there is several research or source how to calculate the sample using the formulation, and also you mentioned it before using G-power. So which one is better? Calculating the sample size using the formulation or something like that, and also using G-power. Which one is better? Because some countries suggest that G-power is the better way to calculate the sample, and some other countries state that you have to calculate manually using the formulation, or we can use the table. If I'm not mistaken, there is several tables. If we have this variable, how many variable, or something like that, factor, something like that. So your sample will be this. So which one is better, Professor? According your expertise or according your experience? For example, for pilot study, for how to say that, experimental research, something like that. How many sample, or which one the better method to calculate the sample? That's his question.
Okay, thank you for this question. I think in now present society, and we are very popular to use G-power to calculate the sample size. I think that is the way, and very popular in our university in Taiwan, in American, in international. Some scholars they use G-power to calculate. But if you're not familiar with this G-power application, maybe it's very easy way to use the item like before. At least one item, you have to think about how many variables you want to test in your study. If you have 5 variables, each variable, how many items in each variable? Because variable, you have to choose the related to this variables instrument. So how many items of your total variable? At least 5. At least every
one items.
Each item need 5 participants. That is basic
calculation.
Yeah.
Oh, right.
That is easy way to calculate. Otherwise, if you not enough sample size to your study, and then maybe your result not very beautiful and not very can accept or reject your assumption, your hypothesis. Maybe you will meet some problem because sample size is too small. It's easy to become error. You will meet the error to mistake.
Okay, so about your opinion maybe and suggestion, which one is better? We use it. Could we should
G-power?
G-power.
Yes.
G-power is okay. The accuracy is also fit if we use a G-power or the formulation or something like that.
Yeah. Any kind of research design.
Okay.
You no matter correlation study or experimental research study, RCT study, or quasi experimental study, all the same. I suggest use G-power. It's easy way. And then when you want to publication, the international journal, they are prefer to see your sample size is calculated by G power.
Oke, oke. Nah, let me translate it into bahasa Indonesia. Oke. Tadi yang tanya Pak Arif ya, Pak Arif menanyakan terkait dengan sample size karena beberapa kali mungkin jadi perdebatan dari kita kalangan pengajar begitu ya, terutama pengajar statistik. Kadang mungkin mahasiswa menanyakan gitu ya, ini sampelnya harusnya berapa Pak? Apakah cukup dengan 30 gitu ya, atau 100 atau lebih dari 200 atau 500 begitu. Nah, tadi sudah saya tanyakan karena beberapa metode yang bisa dilakukan, salah satunya dengan menggunakan aplikasi G-Power atau bisa menggunakan dengan kalkulasi rumus gitu ya, dengan menggunakan tabel dan sebagainya. Nah, ketika tadi saya tanyakan sesuai dengan pengalaman beliau untuk aplikasi dan sebagainya, lebih akuratnya katanya pakai G-Power gitu Mas Pak Arif ya, pakai G-Power untuk akurasinya. Kemudian ketika tidak familiar dengan G-Power, sebenarnya metode-metode tadi juga bisa digunakan. Salah satunya dengan metode yang paling mudah itu adalah dengan menghitung melalui instrumen yang digunakan. Jadi kalau misalnya punya 3 variabel dan setiap 3 variabel itu akan diukur menggunakan instrumen yang berbeda gitu ya. Misalnya satu instrumen ada 10 item gitu. Nah, nanti dikalikan dengan minimal 5 partisipan. Jadi kalau misalnya setiap variabel itu ada 10, jadi 30 ya totalnya, 30 kali 5. Ya 150 sampel. Begitu cara mudahnya begitu. Jadi tidak terbatas sebenarnya, hanya harus menggunakan G-Power, tidak, bisa menggunakan kalkulasi tadi dan bisa menggunakan perhitungan yang sederhana tadi. Jadi memang banyak beberapa sumber sudah menjelaskan kelebihan dan kekurangannya seperti itu. Tetapi kalau beliau tadi menyarankan untuk publikasi di internasional seperti yang sudah beliau alami gitu ya, pengalaman beliau submit ke international journal gitu ya, kebanyakan untuk kalkulasi sampelnya reviewer menginginkan menggunakan G-Power gitu. Alright. Is there any other question to be asked? I think still have a few time, maybe 5 minutes or 3 minutes left. No? Okay. Okay. If there is no other question, I think time is up for today's lecture, and I do apologize if several questions cannot be answered directly, but of course, all of you can still connect with Professor Wu through an email. Is that okay, Professor Wu? If I share your email to the participant, maybe in the near future, they would like to contact you directly to ask about their research interest or do some consultation or some mentoring, something like that. Is that okay?
Yeah.
All right.
Sure.
All right. Thank you again, Professor Wu Sufang, for today's presentation and your valuable time. I hope we can invite you again in the near future program. And please give a warm applause for Professor Wu.
Thank you. Terima kasih.
And maybe please keep on screen. Maybe later we will have a picture together after I close this session. All right. Ladies and gentlemen, our first episode of Visiting Lecture Agenda is come to an end. We will meet again on the next episode tomorrow because we still have another speaker from Malaysia tomorrow. And for closing, I would like to express my gratitude today today's speaker and all of the participants. I hope you are all enjoy this activity. So I will now return the screen and time to the host. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you, Mr. Arik, and thank you for the speakers today, Professor Wu. Okay, ladies and gentlemen, on behalf of the committee, we would like to thank the speakers and the audience for their active participation. Hopefully, the presentation will benefit for us. And keep safe and healthy. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Maybe we can take a picture together, Professor Wu.
Yes. Yes, I'm still here. You can take a photo. Yeah.
Oh, wait a second. Okay, I think we have 5 frames here. I would like to count 1, 2, 3, and then capture every frame. So I hope you all can turn on your camera, and I will capture one by one. Okay, 1, 2, 3. Okay, next page. 1, 2, 3. Next page. 1, 2, 3. Another next page. 1, 2, 3. And last page is 1, 2, 3. All right, thank you.
Ya, demikianlah untuk visiting professor pada hari ini. Perlu kami informasikan bahwa untuk besok masih ada visiting professor lagi dari Lincoln University College Malaysia. Speakernya atau pembicaranya adalah Profesor Dr. Sandi Podar. Ya, kami informasikan bahwa besok bisa join dan hadir untuk mengikuti kegiatan visiting professor. Terima kasih.
Terima kasih Bu Tiwi.
Ya, sama-sama. Ya, baik, kami tutup sekali lagi. Terima kasih atas partisipasi Bapak, Ibu, dan semua mahasiswa yang sudah hadir baik secara online dan offline. Terima kasih sekali lagi kami ucapkan. Sekian kami akhiri untuk kegiatan visiting professor pada hari ini. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Recording stopped.
Waalaikumsalam warahmatullahi wabarakatuh. Izin lab, nggih.